Hey everybody, Dr. Rob Silverman here. Great time at the Wisconsin Chiropractic Association. Want to do a little 5 to 8 minute review on a seminar that I taught on optimizing musculoskeletal health. A couple of shout outs to the sponsors, of course, Nutridyne, Metagenics, and a big sponsor for optimizing musculoskeletal health, Erconia Laser. Let there be light. So let's go over this. And what the big takeaway in optimizing musculoskeletal health is the idea of combining multitude of treatments and getting an effective outcome. Let's fix the patient quicker so we can get that outcome, and they tell everybody. So first thing is movement. So I talked a lot about movement, a functional movement assessment, my Magnificent Seven. 7 different moves to ascertain how people move. Movement is life. It is not as complicated as we think. The immense takeaway is people don't understand that they have breaks in movement. These breaks in movement produce more acid than any food that they could eat. So we've got to analyze their movement and their movement patterns, and even after treatment, make sure they're moving better. Otherwise, it's just going to be a revolving door, and they're going to keep coming back, and the recurrence rate of their injuries is going to be quite high. The key to treatment is laser. How does laser treatment work? Well, interesting enough, there's 3 components to laser. Number 1, it is the wavelength. 635 nanometers is the visible light. There's a plethora of information and publications that talk about 635, the red light being the key to musculoskeletal healing. In addition, low-level laser really should be low power. How much power do we need? We don't need a lot of power. Milliwatts, not watts. We're a big proponent of just enough power to get into the body, to get that biomodulation, to allow the frequency of healing to go. It's all about cell healing. And finally, coherent. Coherent light is light that has the same color, and all the wavelengths are the same. It's a beautiful wave that has a similar color versus incoherent, which is the same color and it's scattered all over the place. The example I love to give, I use it at all my seminars, is my hairspray versus the way I do it, and my wife does it. She sprays like this to get her whole head because she wants to save on the spray. Does a great job. Incoherent, all over the place. Rob takes that hairspray and puts it right there, because it's a perfect coherent wave. So those are the 3 key factors. 3,000 publications with over 200 clinical trials. Unequivocally, laser works and has been proven. It's based on Einstein's law of physics. Einstein's law of physics is very simple in that it speaks about a nucleus and 2 outer shells. The laser sends a photon into the body to stimulate an electron from a very stable inner shell to the outer shell, and then it jumps to the next cell. We call that the branch chain effect. So it's based on Einstein's law of physics. The interesting thing about it is people don't feel it with the laser light, but they do see the results. The end result is cellular regeneration via ATP production and cellular communication via the central nervous system and all nerves in that area, cell membrane, etc. Muscle test strength with the laser. We've shown increased muscle strength, turn muscles on, within 5 to 10 seconds using the laser light. So I can get up in front of everybody and make a change in a muscle strength and muscle movement. Nerve, 635 wavelength, as long as you know, shows the action potentials for nerves to start firing. So with a lot of your nerve entrapments, your sciaticas, your mononeuropathies, etc., laser light is a great choice. And finally, your rehab component. Nothing works better. Nothing allows the treatment to last longer than if you add a rehab component. So put them on a wobble, put them on a rocker board, laser central nervous system, laser their brain, get their proprioception, the balance and space between their nervous system and their muscular system, and you're going to get a better clinical outcome. Let's move on to page 2. We talked about musculoskeletal conditions. The big takeaway in the musculoskeletal condition in a rotator cuff was scapular dyskinesis, the position of your scapula. 100% of people with rotator cuff injuries have scapular dyskinesis. Remember, your scapula has 17 muscles that insert on it, so it's a great starting point to ascertain your overall rotator cuff health. Remember, the perfect shoulder, it's 1/4 of an inch, your subacromial space. So when you put the scapula and the 3 other joints, your sternoclavicular joint, your AC joint, your GH joint, and your scapulothoracic joint, there's not a lot of room for error if your scapula is malpositioned. Disc and sciatica. Disc, some of the bigger takeaways in a disc is you get 28,000 bends at your lumbar spine. So one of the first things we do to avoid a disc injury goes back to movement. Have people move at their hips, not move at their lower back.